everyone, my name is Jennifer Lochner and I'm a registered dietitian and the VA's Weight Management Programs Coordinator. Today I'm joined by my psychologist colleague, Dr. Lisa Burgess. We're going to share some of the most effective strategies for making heart-healthy diet choices that lead to lasting changes. The keys are knowing what to do and then not just using willpower, using strategy. First, we'll start with a motivational tip from Lisa.
So motivational reminders help people stay strong as they work towards their goal. I recommend having strategies to keep front of mind both why you started and why it matters. So we all usually start strong, but motivation naturally fades over time. And I can't count the number of times people have told me, I'll just do it when I'm motivated. But really, we can build up motivation and then reinforce it strategically. So first, connect with your deeper reason. Ask yourself, why does this habit matter to me? And then be specific. So instead of saying, I want to be healthy, say, I want to work out so I can stay active with my kids, feel stronger, and improve my mood. Second, use visible cues. A sticky note on the mirror, a reminder on your phone, or even a simple phrase written on a card in your wallet can nudge you back on track. Finally, expect those setbacks and plan for them. Motivational dips are normal, so instead of feeling like a failure if you miss a day, remind yourself progress, not perfection. Jennifer, can you share a tip for us about being heart healthy?
Of course. So my first tip that I want to share is the power of fiber and the key role that it plays in heart health by helping to lower cholesterol levels and reduce the risk of heart disease. Fiber binds to cholesterol in the digestive system and helps remove it from the body. This leads to lower LDL, or that bad cholesterol. Additionally, fiber supports healthy blood pressure and promotes better circulation, contributing to overall cardiovascular health. A high-fiber diet rich in fruits, vegetables, and whole grains is a great way to protect your heart. Lisa, do you have any tools that can help us stay on track?
So another of my favorite tips is to log and to plan ahead. We know that structure creates success, and one of the most powerful yet simple tools in psychology is tracking progress. Because what we measure, we improve. So write it down. Keeping a log of your behavior increases awareness and accountability. So if you're trying to eat healthier, tracking meals makes you more mindful of that. This can also highlight patterns, like if the afternoon is harder or there's a late night bowl of ice cream that just seems to pop in. Also, planning ahead reduces decision fatigue. If you wait until the last minute to decide what to eat, your brain can disengage and emotion may just take over. So instead, make a plan, prep meals before you get hungry, and decide on healthy behaviors before you're in that moment of temptation. So back to you, Jennifer, for another tip on what to do.
Thank you. So my next nutrition tip involves limiting saturated fats. This is crucial for heart health because saturated fats can raise that LDL, or that bad cholesterol levels, increasing the risk of heart disease. By reducing your intake of saturated fats found in foods like fatty cuts of meat, full-fat dairy, and processed snacks, you help maintain healthier cholesterol levels, support better blood flow, and lower your overall heart disease risk. Opting for healthier fats like those in olive oil, nuts, and avocados can promote a stronger, healthier heart. Lisa, what can we do to increase our chances of success?
Well, attitude makes a big difference. The attitude that works best I call relaxed diligence. So many of us have a tendency to be all or nothing. People can give up on habit change because they set a rigid all or nothing kind of rule. But the truth is that for most people, flexibility increases their long-term success. So ditch that perfectionistic mindset. If you miss a workout, eat an unhealthy meal, or overeat dessert, don't see it as a failure, just see it as a normal part of the process. If it feels realistic though, you can adopt the never miss twice rule. If you miss one day, it's no big deal, but make it a goal to never miss twice in a row. So this prevents those small slip-ups from turning into full-blown habit relapse. We can also focus on identity, not just outcomes. So instead of saying, I want to eat a 2,000 calorie diet every day, say, I'm becoming the type of person who prioritizes my health. So when we change our mindset about who we are, that helps make those habits stick. Jennifer, what else can we do to be heart healthy?
So another thing we can do to be heart healthy is to limit sodium. Limiting sodium is important for heart health because too much sodium can raise your blood pressure, which is a major risk factor for heart disease and stroke. High sodium intake causes the body to retain excess fluid, which puts more strain on the heart and blood vessels. Reducing sodium by cutting back on processed foods and using herbs and spices for flavor can help maintain healthy blood pressure and lower the risk of heart problems. Lisa, do you have any other strategies to help us with our goals?
Yes, changing your environment. Make the right choice the easy choice. Psychologists know that willpower is unreliable, but the easier a habit is, the more likely we are to stick with it. So reduce friction for those good habits. You want to skip the fast food lunch, set your lunch bag on the counter. Want to eat healthier, keep those healthy snacks at eye level. Then increase friction for bad habits. If you're trying to reduce that ice cream, move it to the back of the freezer under all the vegetables. We also naturally adopt the behaviors of those around us. So if we spend time with people who value fitness or healthy eating, we're more likely to follow suit. And if we're around people who are always ordering dessert, we're more likely to order the dessert as well. So our final thoughts: set those small steps to make big changes over time. Behavior change is not about willpower or overnight transformation. It's about small, consistent adjustments that add up over time. Stay motivated with reminders, track and plan ahead, and then be flexible with yourself and design an environment that supports your goals. If you commit to these principles, not only will you change your habits, you'll change how you see yourself. And that's the key to lasting transformation.
If you want to learn more heart-healthy eating and lifestyle habits for managing high blood pressure, high cholesterol, and other heart-related conditions, ask your provider to refer you to the Heart Healthy Nutrition class offered by our dietitians. I want to thank you for joining us for Go Red for Women Awareness Month. Thank you for joining us.